The Kaiser Family Foundation presents health08.org, election news, analysis, and events.
Ray Scheppach of the National Governors Association, thank you for joining us on health08.org.
Pleased to be here.
Your organization obviously has in it 50 state governors with probably as many opinions, 50 opinions. But is there a consensus when it comes to the problems of the healthcare system? What is the single most pressing problem? Uninsured, access, cost. Is there a consensus?
I would think so. I think they most come down on the cost side of the equation. And it's essentially because Medicaid has been growing 11% per year over the last 25 years. It's now 23%
of a state budget.
Budgets. If you add state employees and other healthcare costs, it's probably a third of state budgets. So it essentially equals what you have in terms of education. And unfortunately, we're at the point now that the extra revenues either go into education or into healthcare, but they can't go into both. And so as we move forward right now, this continued cost increases in healthcare are putting a lot of pressure on education budgets.
And there has been so much activity at the state level in the past several years. Massachusetts, of course, the most prominent example, but other states in New England, California gave it a try. What do you see in the states as being most effective to tackle that issue you just described?
Well, I think the states that are trying to develop quality measures and get those to the public, and trying to also move the health IT, electronic healthcare records and that type of thing, moving towards more transparency in terms of quality and price and getting that out to consumers. I think there is a lot of experimentation in that particular area, and I think we are beginning to see some positive results.
In what ways?
In terms of slower rate of increase of costs. This is a long-run effort, so it's going to be some time before we see results we can really depend upon. But I think some of the states are feeling good about some of the things they've seen so far in terms of costs.
For the uninitiated in our audience, not necessarily the health policy audience, but identifying quality measures, how does that lead to cost saving?
Well, essentially what will happen is that you develop quality measures and for hospitals and so on, or nursing homes, and then you get them to report that information, and essentially you put it on the website. So when people are looking around for where to go, which hospital to go, and you've got one that has a quality rating of A and you've got another one that's a C, essentially they'll move towards the quality. Now, to really get the cost effectiveness, though, you've got to combine price transparency. So you'll see some states now moving so that you can essentially bring up information on the quality of the hospital and also information on particular procedures. So if people are going in for a heart bypass or something, you may get the average cost of a hospital for that. So it's a combination, really, of the price information around particular procedures and so on with the quality measures, where I think we're beginning to see some traction in terms of cost.
And that would impact consumers who have private insurance, but what efforts are you seeing in terms of Medicaid on the ground that's helping?
Well, there I think most of the work so far has been in the pharmaceutical area, where they've used formularies in basically negotiating with drug companies around a particular drug, and then also with respect to generics. So that's been helpful. The other thing that is states are really working a lot on is disease management. I mean, we all know that there are 7 or 8 diseases that end up spending 65-70% of the money, so that if you can become more efficient in diabetes treatment and those things. So there's been a lot of work there where you set up with nurses and so on, calling individual patients to make sure they come in for the treatment. So that's been a very hopeful component of it as well.
Talk to me for a moment about the current tension between the governors and the federal government in terms of what the Bush administration wants done with Medicaid and how that impacts what we've been discussing?
Well, I think, one of the things that's happened historically is that there's pushing and shoving, in all honesty, where states attempt to push some of the costs back to the federal government, and the federal government pushes it essentially back to the states. And so there's been a group of about 7 regulations that have been promulgated that essentially do cost shifting back to states. I mean, some of them involve how you can raise revenues. A lot of times states have done provider taxes. And so the administration has certain requirements on actually how you do provider taxes. And they think if they restrict that, then states will have to come back on their benefit levels or eligibility or that type of thing. So I will say that this has gone on for a good 20, 25 years. But more recently, I think that this group of 7 regulations that the administration has come out has been a pretty major shift. It's like $15 billion over 5 years, which would be difficult at any time, but clearly when you've got states having major economic shortfalls in terms of revenues and so on, it's much more difficult right now. So that's why we've been pushing the Congress to pass moratoriums so that we have some time to work out these issues. We know that there are some legitimate issues there, but we all have to sit down and talk them through and see whether we can't resolve them.
And I should say that the Bush administration's argument is that there is some bookkeeping done at the state level that pushes an unfair amount of the cost onto the federal government.
That's right. And that deals with a lot of the so-called provider taxes. They think there's sort of recycling of dollars. We've dealt with that, we believe. I mean, there's essentially was a law 8 or 10 years ago, and then there was other regulations that we negotiated. I can't argue that we're 100% with clean hands in all honesty, but any major in terms of recycling, I think, is over at this point.